I'm Marnix Heersink, ophthalmologist at Eye Center South. Well, a cataract is a cloudiness of the human lens, and when the patient is young, obviously most of the time there's not an issue, but as you get older, that lens tends to become cloudy and milky and it starts to obscure your vision. This can be very incapacitating. You notice that things you normally used to be able to do, you can't do as well. Driving, seeing at night, things become fuzzy, sunlight can make things blurry. So when that happens, we know there's a cataract involved after we do all of our tests. And then we take the time to explain what things are going on and what can be done for them. Once the diagnosis is made, then we sit and we talk to the patient, explain to them what the options are. And they range from things like, well, let's not do anything. Let's just wait and see how things develop, to time to do something. And if you do surgery, of course, there's many options involved with that. We now have the wonderful ability to take a patient and take their diseased lens out and put a brand new fresh one in that is artificial. That artificial lens lasts as long as the patient is alive, and it gives them a much, much better vision. And even in that category of lenses, we have options for them. We can arrange for them to have vision in one spot, various spots, nighttime vision, lots of opportunities to give them a chance to really make it a good decision, what suits them the very best. I reassure them that the procedure is very safe. This is the world's most #1 operation being done today. It's an extremely safe, successful, and effective surgery. So you can be reassured by knowing that. The actual procedure is usually about 10 to 15 minutes or sometimes less. And it should not be uncomfortable, there should not be any pain. And we have the anesthesia monitoring, we have medications to make somebody feel very relaxed, sometimes a little bit sleepy, which is not all bad. We do one eye at a time, and we know that the procedure, again, is very straightforward and successful. And after the procedure, we go over all the instructions, all the do's and the don'ts, the drops and the medications, and we let you go home. And then we follow up with a telephone call to make sure you're feeling comfortable and doing well. And then sometimes you'll come in the next day and we'll follow up and see you in person. Or occasionally we work with our optometrists and our other co-providers and make sure that the patient's well taken care of and seen. And then we can proceed with the other eye, and that's generally done within a week. Sometimes a little sooner, sometimes a little later, and of course the patient's preference is very important. By the time the diagnosis is made, generally within a couple of weeks the patient's had surgery in both eyes, recovering nicely.